afternoon, everyone. Yes, as Chris said, thank you for spending your afternoon on this one of our very last summer Fridays with the city team here. We are so excited, and I think you are too, that we finally have these wellness grants available. The team that you will hear from today, Chris, Erica, Desi, Eileen, Corey, and then Joseph and Danielle, we'll walk you through the different programs that we have, how to apply, and answer questions for you. We just this week actually officially announced our partnership with Scranton Counseling Center to have co-response with the police department and the counseling center to some mental health calls. So we're really tracking well on our goal of attacking some of these wellness issues that are always here in Scranton, but have really been exacerbated by the pandemic, not just here, but nationally. So thank you all for all that you do for our community every single day. We deeply appreciate you, and we're very, very excited to get this money out into the community and see how we can make some progress. Thank you.
Perfect. Well, thank you, Mayor, for that. So Chris, if you don't mind, if you would pull up the slide deck that we have for everybody. As the mayor said, thanks again for everybody's time this afternoon. We're really excited to roll this next phase out for everybody and get money into people's hands to start doing some real good here in the community. As the mayor mentioned, the focus here for this rollout is on wellness, mental health, behavioral health, drug and violence prevention. Those are all associated components of this rollout. If you were involved or you may have seen or heard of the nonprofit recovery grants that had just actually closed about a week and a half, I guess 2 weeks ago now, that focus was really on helping nonprofits that have been identified as impacted nationwide, but specifically within the city of Scranton, kind of get back on their feet. Now we're taking that next step where, as the mayor had stated, Treasury is certain that due to the pandemic, communities across the nation have really experienced some major issues when it comes to wellness and health. And they know that there's a lot of work to be done on that side. So the focus of this next rollout is specifically on that. So this slide deck is going to take us through a little bit of the purpose. We'll do a brief American Rescue Plan Act overview. Then we'll talk a little bit about the notices of funding availability, summary, and structure. It just kind of gives everybody here on the call today that broad overview of where this grant rollout component fits in with the rest of the programs. Some, like I mentioned, the nonprofits that have already opened and closed, and the others that are still on the horizon to become open. Just so you have that in your head as we go through. Just a general overview of the purpose here for today. So we want to give you that broad overview of the city's wellness grant programs, what they are, what they mean, what's available there, and then also provide that insight into the additional grant programs that are coming soon or on the horizon here. Broad strokes, the American Rescue Plan and an overview there, about 1.9 trillion was given through an economic stimulus bill. 365 billion of that went to state and local governments, and the city of Scranton has now 68.7 million of that to allocate to these different efforts. So the focus for today is really on these two pillars of the American Rescue Plan Act, which are the public health expenditures and the negative economic impacts. So we know, like I'd stated before, right? These are real problems that have been exacerbated by the pandemic since 2020, and Treasury's looking for ways, and now the city of Scranton, to help fix that and get community back on their feet. So this is a broad overview of estimated allocations right now by major buckets. So you'll see we've kind of broken it into public health and education up at the top and what would be included in there. So overall, we've kind of branded this as the wellness grant rollout here. Included in that are things like the behavioral health response and violence prevention, the drug overdose and prevention that we had talked about. Some of the other items under public health and education that you see there: affordable childcare, community health worker program, educational catch-up. You'll see on the next slide kind of where those fit into the overall rollout process. But again, the focus here is on those wellness and health grants. So graphically, and what you'll start to see on the city's website, if you haven't visited yet, I highly encourage you to go do that. There's a lot of good information there. But each one of these programs now has a specific icon associated with it. So if you think you fall into one of these buckets, in particular for today, it's going to be that wellness grant icon, the one that's circled there on the right. That's where you can go to find more information about the grant itself, What are the eligibility requirements? What are some examples of some potential eligible programs or expenditures that fall into that specific program? But today we are going to be talking specifically about the Wellness Grant Program. You'll notice too on that right-hand side of the slide, there is a term there, beneficiary or subrecipient. Both are applicable for this type of grant. In the nonprofit grant that we just finished, and some of you may fall into that category as well, you may be a nonprofit that offers public health service. So you may have seen that. You may have actually submitted an application for that. That was really as a beneficiary, right, for that economic hardship, trying to help again with that recovery piece. Now here, the focus is going to be on both the subrecipient and beneficiary component, which we'll get to that definition here in just a second. Okay, so let's talk a little bit about what a subrecipient versus a beneficiary is, because this is going to be required, or you guys will need to know this as you go through the application here. So at the very top, the City of Scranton, they are the recipient. That's how they've been identified by Treasury. From there, to get the money into the hands of the community, there are really two paths to take. One is to fund a subrecipient, or to directly fund a beneficiary. So a subrecipient, what is that? Well, a subrecipient is an entity that would determine who is eligible to receive federal assistance. They would measure the performance based on meeting objectives of the federal program. They'd be responsible for making programmatic level decisions, responsible for ensuring federal requirements that are outlined in the award are followed. And then basically they would use the federal funds to carry out a program as opposed to providing, goods or services on behalf of the city as a subrecipient. A beneficiary, on the other hand, is an individual organization receiving the funds as the end user, or the entity directly benefiting from the financial assistance. A beneficiary in that instance doesn't need to determine eligibility or compliance. So diving a little deeper into the subrecipient, and in particular for this grant rollout. So subrecipients will be those eligible third parties. They could be nonprofits, they could be private and or government organizations, but they are organizations, and they will be those that will be carrying out the eligible uses on behalf of the city. As part of that, they'll have to adhere to 2 CFR 200, which are all the federal guidelines for administering federal funding. Now, as part of your if awarded in your agreement with the city, all of that will be lined out in your subrecipient agreement. Very very well spelled out in terms of what those requirements are. But it's basically just right to make sure that the funds get handled in an appropriate way. So subrecipients here in this case, they'll be responsible for identifying a COVID-19 public health impact on an individual or community group, and then designing or funding an existing health program or project that directly responds to that impact. So again, for this rollout, subrecipients, organizations is key, right? They've got to be that. They will be providing benefits to residents of Scranton as the beneficiaries through the program that they develop, whether it's a new program or an existing program that they fund. But that program has got to be focused on public health, wellness, with the examples we gave before about behavioral health, mental health, drug and violence prevention, and anything that qualifies within that. Just a little side note here as well. We're assuming that there's probably going to be a greater ask than there may be money available. So a note that greater consideration will be given to projects or programs that serve disproportionately impacted or economically disadvantaged individuals within the community. So Treasury has been very adamant about wanting to make sure that those disproportionately impacted communities and residents within each city or county, that they ultimately get to feel the benefit of these funds. So as such, these applications will be looked at in that manner. So what are some examples of eligible uses as a subrecipient? So it could be any of those public health programs that are really designed to mitigate the spread or the impact of COVID-19 on a specific individual, population, community. There's some examples there that we've given for the behavioral health, violence prevention, drug prevention, wellness. On the website, what you will also see, and as I encouraged before, there's a lot of good information there. But if you were to click on the Wellness Grant icon, and there is a link to the website in this presentation, this will be made available to everybody as well. But if you go there, there's a long bulleted list of some great examples that fall within each one of these categories, just to kind of get everybody thinking about those eligible uses. I do want to say, though, that may not be all of the eligible uses. Really, what it's going to come down to is as an applicant, if you can identify an impact that COVID has had on, again, either an individual, a community, a group of folks, if you can identify that impact and then design a program to meet that impact under the umbrella of wellness, that is something that would be considered and reviewed for potential eligibility. So again, those bullet points are very helpful, but that's not an end all be all list by any means. Beneficiary. So let's talk a little bit about that. So sub-recipients, think programs. Beneficiaries, these are going to be those same eligible third-party nonprofits, private or government organizations, and capital expenditure projects that could be eligible to fund. So if you're asking for money to fund a capital expenditure project, in that instance, you would be considered a beneficiary. Again, you would still have to go through a similar exercise. You'd have to identify an impacted group of individuals, classes within the city. And in addition to that, this capital improvement project that you'd be submitting would have to support that group, and it could support them by way of supporting the public health program that supports that group. So in addition to that, you'd have to go through the same exercises of identifying that negative public health impacts due to COVID. We'd have to make sure, and your application would have to ensure that the funding that you're requesting is reasonably proportional to that demonstrated impact. So in particular for a capital expenditure project, right, we know those can get pretty pricey depending on what it is. But if there's one that comes through that's very large, but it looks like the impact that was identified may not be proportional to it, just keep in mind that may in of itself create an ineligible capital expenditure project submission, and we'd have to view it as such. So just keep that in mind. Proportionality is very important. You would also have to provide evidence that the organization serves city residents. And then on the next slide, we'll go through a few other capital expenditure eligibility requirements. And just a side note here that, again, these grant applications, they're really open only to organizations at this point that serve city residents, not for individual residents to go through and apply, kind of on a solo basis. So just wanted to reiterate that. So what are some examples of eligible uses for a capital expenditure project? So really, because they could be, pretty broad, and as long as they kind of hit these 4 key points, they could be considered eligible. So the first is, you'll have to detail in your application what that capital expenditure is, and it must respond directly to the pandemic and be proportional to the demonstrated impact. So those 2 words are very important, right? Respond directly to the pandemic and proportionality. They also must serve or provide benefit to city residents. They could also serve or support city residents through a public health program, either an existing or a new one. And then in addition to that, any capital expenditure project that ultimately is deemed eligible and awarded, it will have to adhere to your own organization's internal procurement policy. If you don't have one, then the default policy will be the City of Scranton's policy, and we can provide that if and when needed. So here, I'm going to actually turn it over to Chris, and I think he's going to talk a little bit about the neighborly application process. I think he's actually going to bring up the screen and kind of walk us through a little bit what that application looks like. But real quick, before we do that, high level, just a quick note on funding availability for each one of these topics and programs. So in our behavioral health and violence prevention program bucket, the city is making grant awards available up to $100,000. Under the drug overdose and prevention program umbrella, grants would be available up to $50,000. And then any general health or wellness programs, those grants would also be available up to $50,000.
Good afternoon, everybody. For those of you who I have not met yet, let me do a couple of quick introductions. My name is Chris Hughes. I'm the city's ARPA Communications and Information Manager. I am going to drop some contact information for me into the chat in just a minute. And again, I see there's already a couple of questions in the chat. I want to encourage everybody to drop their questions in so we can address them at the end of the meeting. But I also want to introduce my colleagues from the city real quick. Eileen and Erica, if you could just introduce yourselves.
So good afternoon. I'm Eileen Cipriani. I'm the ARPA Director for the City of Scranton. So delighted to have you here today as we continue to roll out all these great programs we have.
Hi, everyone. Erica Yurkovic, and I am the project manager for ARPA with the City of Scranton.
Thanks, guys. I am going to drop a link into the chat as well as my email information. And this is going to be the link that will allow you to access the Neighborly portal that we're going to be using for the purposes of accepting these grant applications. So I'm going to share my screen once again, and we're going to walk you through some of this together. So if you were to pull up that link right now, this is, hopefully everybody can see my screen at this point. This is what Neighborly is going to look like when you first log in. Actually, it's going to default to the sign in tab. If you are new to this process, if you have not applied for anything through the city before, through the Neighborly portal, you're going to want to register a new account. It's going to ask you for an email address twice, your first and last name, and then password, and re-enter your password. That's going to generate a verification email back to you. So check your spam folders, your junk folders. If you're like me and you use Outlook on a web browser, check your other bucket of emails rather than your focused email inbox. That's actually where some of my Neighborly stuff ends up. So I know that you should definitely look for it there. This is also going to be the login that you're going to use for additional potential buckets of ARPA funding. So make sure that you keep your login information handy and that you make it easy to remember. There is, I'm certain, I don't see it on this screen, but there's got to be a password recovery function in case anything should go wrong. But so this is what it looks like when you're not logged in. I am logged in on another window. So once you are able to access the system, this is essentially the screen that you're going to see. If you have started an application, you'll see this field first to allow you to view or continue an existing application. But most of you, the first time you log in, are going to see this section where it says start a new application. I want to make sure that we talk about this really specifically because the city does have a HUD homebuyer program that is unrelated to ARPA, but you folks are going to access the ARPA program grants. And again, this is for the wellness programs, but it's also for a variety of other grant funding opportunities that are going to roll out in the future. So I'm actually going to walk through kind of a test application so we can look at what it's going to look like on your end as an applicant. So when you come in, it's going to ask you to use the link below to continue the application process. And the first screen that you're going to see is going to ask you about whether you are applying for a beneficiary award or a sub-recipient award. I don't want to reiterate, Desi did a great job kind of explaining what that involves so far, but I'm going to choose a sub-recipient award as we test this application today. That's going to generate a second window, and you are looking for the three areas right here in the middle: award for drug overdose prevention program, behavioral health response and violence prevention, or wellness programs. Just for the purpose of today, I'm going to choose wellness programs. And then there's a question here about the qualified census tract. That may be a term that's unfamiliar to many of you. The qualified census tract is a census designated area of the city that's based on a number of economic factors. Just very briefly, there are QCTs in Scranton, in the downtown near Manuka, in North Scranton, and in West Scranton. For certain applications, but not for these applications, your location or proximity to a qualified census tract is going to be important. But for this one, I'm going to choose no, just to show that if you're not in a QCT, it's not going to impact your application itself. But it is important to reiterate what Desi said. You do need to show that you serve Scranton residents or will serve Scranton residents with a new program that you're going to roll out. So I'm going to hit save. You can save your application at any point in the process. We encourage you to do that. Nobody likes to fill out grant applications and lose half of their data halfway through. So the first section here, the A section, is contact organization. So you can read through all these fields: legal name of your organization, if you have a doing business as, your CEO's name, federal tax ID. You can see all the relevant fields here. I want to talk real quick about the contact information field. If you have somebody in your organization that's maybe not a COO or a president, maybe you have a grant writer, I would encourage you to use the grant writer or whoever's filling out this application on behalf of your organization here. That is most likely the person that we're going to get back in touch with if we need to request additional information or any kind of additional paperwork from your organization. So that allows us to have generic contact information for your organization and direct contact information for who is filling out your grant application. The B section covers organizational information. So date the organization is founded, your tax exemption status, if applicable. As Desi mentioned, we just ran through a number of nonprofit grant applications with the help of the Scranton Area Foundation. Those did require tax exempt status. These do not. The geographic areas that you serve and your organization mission statement and purpose. If you see here, if you're applying for a small business startup expansion grant, please input NA for questions B5 through B9 below. That's something that will come with a later bucket of funding. But the number of part-time employees, number of full-time employees that you have, the services that you provide to the city of Scranton, that's all going to be really important information as we consider all these grant applications. And again, one thing that I want to note that we haven't touched on yet, this is not a first come, first serve bucket of funding. We are going to be reviewing all applications after the September 16th deadline. So while we don't encourage you to rush through your application, we do encourage you to get started so that you can make sure you can complete this in time. As of today, there's about 3 weeks remaining until that deadline hits. Question B12, does your organization serve persons or households? That's something that's going to be determined by each organization. And there's additional data here in area B13 so that you can tell us about those numbers. Your grant request information. So this is where you can provide us with information about what you hope to achieve with the grant. The first piece here is the total financial request amount. As Desi mentioned, there are I don't want to say limitations. I think that's a poor word, but there are, ranges of funding that we have put in place to make sure that we can provide support to a number of different programs and communities. C2 is a really important question. I want to take a note here and talk about this for a minute. If the amount of the grant that you're requesting is for $50,000 or greater, please provide your sam.gov ID number. Some of your organizations may not have this ID number yet. And the reason I want to touch on it right now is there are communities across the country that are applying for American Rescue Plan funds. As a result, some of the organizations that we've talked to here in the city are experiencing a little bit of a bottleneck in obtaining a sam.gov ID number. Obtaining a sam.gov ID number is free. There are services out there that will try to charge your organization a nominal fee to be able to obtain one. We don't recommend that, but it is definitely a little bit of a waiting game with a lot of folks trying to access federal funds, perhaps for the first time. The type of grant request, some of these fields are going to be relevant to other buckets of funding, but down here, this is going to match what you had selected in the beginning. So sub-recipient award, this is for new programs or services, sub-recipient award for existing programs or services. If you are applying for a beneficiary award for eligible capital expenditure, this is the field that you'll choose, and describe in detail what the grant funds will be used for. So this is really where you get to begin to tell us what you hope to achieve through this once-in-a-lifetime funding opportunity. If you do click around in the application and try to skip, it will say, hey, you've made changes in here. Do you want to save? And we definitely encourage you to do that, but because it's a test today, I've kind of skipped it. This is an important piece here. Are you applying for a direct beneficiary grant? I'm going to select no. If you are applying for the subrecipient, select complete and continue. So we're going to move ahead there. Are you applying for the subrecipient award? Yes, we are. So as you can see, that actually opens up a whole new set of data. Has your organization previously managed or utilized federal grant money or support in the past? That's an important question because we cannot fund or duplicate funding for programs that have received federal grant money in the past. In the nonprofit applications that closed earlier this month, that affected folks who may have received CARES Act funding or payroll protection loans or anything like that. So that's an important designation for us. E2, the applicant agrees it will have all funds contracted or obligated by September 30th, 2024, and expended by September 30th, 2026. E3 covers how people in your community are being affected post-COVID-19. As Desi said, we know that COVID-19 obviously had a number of obvious health impacts, but there are a lot of underlying health impacts that these grants are intended to address. E4 covers how your program will proportionally respond to those impacts. E5 allows you to describe the goals of your new or existing program. And in here, providing key performance indicators and metrics, how you'll gather data to determine the impact in your community and the success of your programs. E6 is also important. It's going to let us know how you intend to sustain this program after the ARPA funding has been spent. We want to make sure that we are supporting programs that don't just offer one-time services and then go away. We're kind of viewing this as seed money for programs that can benefit the community for years to come. E7 covers how many people and what groups you'll be able to help. And E8 goes a little bit further into that about how does your project or program include voices from disproportionately impacted groups? Have you engaged other community partners in your program? So we do know that some services have unfortunately not touched all pieces of the community. Some of the research that we have looked at from partners as we've prepared for these grants show that economic demographics and ethnic demographics and things like that can unfortunately be barriers to programs in the past. We want to make sure that these are programs that reach all areas of the community. Alternate funding. So this goes back to, has your organization received other COVID-19 funding assistance? That's a very important question for us because, again, we want to make sure nobody is duplicating funding for particular things. Are there other grants the organization has currently applied for or intends to apply for? Does the organization currently employ or have access to a grant writer? And has the organization previously managed or utilized federal grant money or support in the past? Section G is all about financial and insurance information. So revenue for the past year, current fiscal year revenue and expenses, the dates of your fiscal year. Some are going to have a July 1st fiscal year start, an October 1, and January 1. I think that's all of the common ones. But those are important dates for us to consider. How your organization typically raises funds pre-COVID-19. We know that COVID-19 did definitely impact organizations' abilities to raise funds because we weren't permitted to gather in large events. And then insurance information here for general liability, automobile liability, and workers' compensation. And then this is another particularly important section of the document. This is the required documents that will allow you to upload files with really important information, a number of required fields in here that I know were, I don't want to say a trouble spot, that's kind of a negative approach, but they were definitely one of the things that we answered the most amount of questions on during the nonprofit grant cycle. So you can see here detailed itemized budgets, current copies of IRS W-9 forms, your tax returns or your 990 forms for the 3 most recent years. The 990s will be for nonprofit organizations, a copy of your IRS letter or certificate verifying tax exempt status, if applicable to your group, lists of board of directors for nonprofits, articles of incorporation, monetary and in-kind donations from the city, the last 2 fiscal years audited financial statements or unaudited financial statements along with certified statements from the organization's president and treasurer, last 2 fiscal years, of bank statements. The remainder of these are fields that are only if they're applicable to your organization. Because many of you are applying for new programs or existing programs, some of these may not apply to you, but we do have the opportunity, if we do require that information, to re-engage your organization and ask for that. I want to come back up to the top real quick on these itemized budgets. There are sample budget documents here for your organization to download. And we've already gotten a question about these, which is why I wanted to touch on it real quick. This will open, if you're like me, a lot of your PDFs will open in your web browser window. But if you do that, it will not allow you to click in them and type in them as a fillable document. So it's important, if you're going to use these as sample budget items, that you actually physically download the PDF file to your machine and open it in an Adobe Acrobat reader of some kind. When you do that, there's usually a sidebar on the right-hand side that shows up, and there's a little like purple pen icon that says like fill and sign. That should turn it into an interactive document that will allow you to type into it. If anybody is using this document and continues to have problems with it, again, my email address is in the chat. I encourage you to get in touch with me, and we may be able to edit that in other ways to make it easier for your organization to use. It will not allow me to click on submit on the bottom because I've left all of these fields blank. So that's important to note. Again, like I mentioned before, you can save your application at any point and come back to it. There are, like I said, 3 weeks remaining for this application deadline. And when you're all done, you can hit complete and continue. If I were to try it on another field, it's actually going to tell me all of the areas that are required. So that's really important. It will not allow you to skip a required field or not present information that we need for this grant process. That was a lot of information to take in. I know, because I did it for the first time myself to make sure I was prepared to help you folks today. I know there are a number of questions in the chat. I'm going to ask Eileen to read off anything that we maybe have answered that might be for the good of the group, or any new questions that have come in.
Sure. I've answered all the questions except for the last one that just popped in, and it says, can a non-city resident apply for a small business startup that will be located in the city of Scranton for the benefit of city residents? And yes, the business itself, and these particular grants, that will come later, the small business grants, but the business itself needs to be located in the city of Scranton for small businesses, not the owner of the business. But that's something that we'll get to in a bit, maybe next month.
I think that's actually a good question. So that's obviously a business startup. Can you remind me of the time period that folks need to have been in business or been providing services in order to be eligible for these grants?
So the business startup will be something that started after March of 21. So that's the relatively new business. So we're looking for them to be new to the city of Scranton that's just starting up or just got underway during the time of COVID. We will also have two other programs that are not related to our nonprofit grants here. That will be a wage supplement program and grants for small businesses for future-looking projects. So those things are down the road. We'll probably be revisiting those in October to put those out. The small business, the startup grants, though, you'll find they'll probably be active after Labor Day.
I have a message here. Is there a character count for each response? I believe that there is, but I'm not aware of what that character count might be. So I do apologize if you have a wonderful grant narrative that you have to copy and paste from maybe a Word document and then edit down. Apologies in advance.
We have another question here. Can each organization only apply for one grant, or can we apply for more if we have other programs that need funding? There is the character count question there. Yes, you can apply for multiple grants.
The education grant's still open. I don't believe we've opened the education grants yet, correct, Eileen?
We have not.
Okay.
So the only grants that are open right now are the wellness grants. So you have your behavioral health, you'll have your wellness grant itself, and drug overdose prevention grants. That's what's open at this moment.
I see someone in the meeting has their hand raised. I don't know, Chandra, I don't know if you have a question that you need to ask, not in the chat.
Yeah, that's me. I'm Chandra, by the way. I think I'm the new in this group. Yeah, we have been conducting we coordinate with University of Scranton since couple of months, and we organize like diabetic education, stress management, high blood pressure, cholesterol, physical health, nutrition, and health educations in our community. You know, each time more than 100 people senior attend our program, and our next program is going to start from this September 1st week. We don't have any resources. So far, we are doing from voluntarily, and we are very much tired, and we are doing best from our side. And we don't have grant writer in our community, in our group. So if there is anybody else who can help us, we will be highly appreciated.
Chandra, you brought out a really good point, and something that we're looking for and hope to see in these applications is community partnership. So multiple agencies partnering together to put programs forth. So thank you for highlighting that.
Yeah, that's going to be a really important part, we think, towards the sustainability of these programs. If you're able to bring multiple groups together, Chandra, I know you mentioned that there's no resources, but I heard you mention the University of Scranton and Geisinger. So it sounds like there's support, but you need aid to be able to help your community on a broader basis. That's really what these are for. The mayor has said multiple times, we really think that these are programs that are going to provide a lot of good towards people, especially in communities that particularly need it. Does anybody else have any questions to put in the chat or anything else that we can answer? We're also going to have this webinar posted to the city's ARPA website at scrantonpa.gov/ARPA. So this will be available to review if you have any questions about that. Again, My email address is in the chat, and we are continually updating items like the frequently asked questions and things like that based on what the community is experiencing as they apply for this grant funding.
So as you go into exhibits 1 and 2, Chris had walked us through, and at the end of the application, you saw the document portal and what needs to be uploaded there. So exhibit 1 is what you would use if you were applying for a sub-recipient grant, which is going to be any of those new or existing health programs. And you'll see on the left-hand side, I know it's a little bit small, but as you open this in your own PDF viewer, if you decide you want to print it out, fill it out and scan it in, or however you want to upload it, it's fine. It'll read better that way. But it kind of breaks down into the key categories that we would assume would go into a program that way in terms of admin costs, any professional services. If you've got a legal team that's helping put any of the guidelines together, training, supplies, those kinds of things associated with it, you would fill it out with your anticipated cost. And I think something to note too, in regards to both of these budgets, we'll get to the beneficiary exhibit here in just a second, is that these are your anticipated, your estimated costs. And the way that this is going to work is, if your program is deemed to be eligible, if it's prioritized as high priority, it gets awarded, it's going to be a reimbursement type of award. So you will have to, once you're awarded, actually submit evidence of expenditures against some of these categories that you're going to highlight in this potential budget here, or this estimated budget. You're going to submit those to the city, and then you'd be reimbursed for those costs as those costs are incurred, and work it that way. This is not both of these, and if you don't mind, Chris, let's go to the next exhibit. These are not your organization's yearly budgets. That's not what they are. These are the estimated budgets for the specific grant that you're applying for here. So this is what the beneficiary budget looks like. Again, because these are being identified as capital expenditures that are either supporting or directly supporting one of those new or existing health programs, or if it's a capital expenditure like a supply, right, that is directly supporting a resident of the community. That's what would go into this budget worksheet here. Again, same thing on your PDF viewer, you print it out, upload it, however you want to do it, but it's broken up into slightly different categories, things that are more likely associated with a capital expenditure. In both of these, you'll see we added a contingency line item there as well. Again, we understand these are estimated, but putting a little bit of a contingency in there is always a good idea, just in case something ends up going, specifically when we're talking about capital expenditures, right, in the construction market, just in case something ends up going a little bit over budget. There's some money in there that if you need to, it can be used to kind of help bridge some of those gaps. But again, this will also be done on a reimbursement basis. So if you're hiring, a contractor, or if you're buying some type of furniture or furniture piece or something like that to support your program, you'd send in that invoice or evidence of that expenditure, that pay application, that purchase order, whatever it looks like for your organization, and then that would be reimbursed by the city. So follow the instructions. Hopefully they're clear, but again, just wanted to make sure we're all on the same page. These are not your organization's yearly budgets. These are specific budgets to these grant programs, to these capital expenditures that you're submitting as part of your application. And then here's just a quick timeline, just to remind everybody, right? So these grants, they did open up on Monday. Today is our first info session. And then on September 16th, that will be the deadline where all of these will have to be in the queue, because then we're going to start our eligibility and prioritization reviews almost immediately after that following Monday. So make sure if you got questions before then, like Chris mentioned, his email address is out there, and we hope to answer as many of those as we can. So
great. Thank you, Desi. Appreciate that wrap up. I did see 2 more questions pop in. I didn't know if
when will the nonprofit grants be announced? And we're looking at that. We're still reviewing eligibility. We have to score them yet. So we're looking at mid-September as a time when we'll get those announced. And will the reimbursement documents required for funding be uploaded through Neighborly if the organization is awarded? Yes, we will use Neighborly as the intake instrument to pull in your invoicing.
It's a busy Friday. You're all busy running organizations or helping other people run organizations. So want to thank you for the time. Again, this will be up on the scrantonpa.gov/ARPA website for review. And we'll also have a PDF copy of the presentation from our partners at Answer Advisory, so you can review any of those documents there.